What is tuberculosis, TB? Tuberculosis, TB, is a serious infectious disease caused by a bacterium called Mycobacterium tuberculosis. It primarily affects the lungs, a condition known as pulmonary tuberculosis, but it can also spread to other parts of the body such as the brain, spine, kidneys, lymph nodes, and bones. When TB spreads beyond the lungs, it is referred to as extrapulmonary tuberculosis. Tuberculosis has existed for thousands of years and remains one of the leading infectious causes of death worldwide. Although it is both preventable and curable, it continues to affect millions of people every year, particularly in developing countries. TB spreads through the air, making it highly contagious under certain conditions, especially in crowded or poorly ventilated environments. TB is not just a simple lung infection. It is a disease that interacts deeply with the immune system and can remain hidden in the body for years before becoming active. Understanding how TB works requires understanding how it enters the body, how the immune system responds, and how the bacteria survive. What causes tuberculosis? Tuberculosis is caused by the bacterium Mycobacterium tuberculosis, a slow-growing, rod-shaped organism with a thick, waxy cell wall. This special cell wall makes the bacteria highly resistant to environmental stress and some disinfectants. It also makes TB harder to treat because antibiotics must penetrate this protective barrier. The bacteria spread from person to person through the air. When someone with active pulmonary TB coughs, sneezes, speaks, laughs, or sings, tiny infectious droplets are released into the air. These droplets can remain suspended in the air for several hours, especially in enclosed spaces with poor ventilation. When another person inhales these droplets, the bacteria can reach the lungs and begin infection. It is important to understand that TB does not spread through shaking hands. It does not spread through sharing food or utensils. It does not spread by touching surfaces. It spreads primarily through airborne particles. Close and prolonged contact with an infected person increases the risk of transmission. How tuberculosis happens. When TB bacteria are inhaled, they travel down the respiratory tract and reach the alveoli, which are tiny air sacs in the lungs where oxygen exchange occurs. At this point, the immune system responds immediately. Special immune cells called macrophages attempt to engulf and destroy the bacteria. However, TB bacteria are unique because they can survive and multiply inside these very immune cells. Instead of being destroyed, they use macrophages as a hiding place. The immune system then reacts by forming a structure called a granuloma. A granuloma is a small collection of immune cells that surround the bacteria in an attempt to contain them. Inside the granuloma, the bacteria may become inactive but not dead. This stage is called latent tuberculosis infection, LTBI. There are two major forms of TB infection. 1. Latent TB infection. In this stage, the bacteria remain alive but inactive. The person has no symptoms. The person is not contagious. The infection can remain dormant for years. However, if the immune system becomes weakened, latent TB can become active. 2. Active TB disease. In this stage, the bacteria multiply actively. The person develops symptoms. The disease can damage organs. The person can spread TB to others. Approximately 5 to 10% of people with latent TB will develop active TB at some point in their lives, especially if their immune system becomes compromised. Risk factors for tuberculosis. TB does not affect everyone equally. Certain conditions increase the risk of developing active TB, HIV/AIDS, which severely weakens immunity, diabetes, which reduces immune response, malnutrition, which impairs defense mechanisms, smoking, which damages lung tissue, alcohol abuse and drug use, chronic kidney disease, cancer or chemotherapy treatment, use of immunosuppressive medications such as steroids, living in crowded or poorly ventilated environments, working in healthcare or prisons. The strongest risk factor globally is HIV infection, because HIV attacks immune cells that are essential for controlling TB. Symptoms of tuberculosis. Symptoms depend on whether TB is pulmonary or extrapulmonary. Symptoms of pulmonary TB, lung TB. The most common symptoms include persistent cough lasting more than 2 to 3 weeks, coughing up blood, hemoptysis, chest pain, shortness of breath, unexplained weight loss, loss of appetite, night sweats, persistent fever, fatigue, and weakness. The cough is often the earliest symptom. As the disease progresses, lung tissue becomes damaged and cavities may form inside the lungs. These cavities contain large numbers of bacteria, increasing infectiousness. Symptoms of extrapulmonary TB. When TB spreads outside the lungs, symptoms vary depending on the organ involved. TB of the lymph nodes, swollen, painless lumps, often in the neck. TB of the spine, Pott's disease. Back pain, spinal deformity. TB meningitis, severe headache, neck stiffness, confusion. TB of the kidneys, blood in urine, flank pain. TB of the bones, joint pain and swelling. Extrapulmonary TB is more common in people with weakened immune systems. How tuberculosis affects the human body. TB primarily damages the lungs, but its effects can be widespread. Effects on the lungs. In pulmonary TB, inflammation destroys lung tissue. Cavities may develop, reducing lung capacity and impairing oxygen exchange. Over time, severe cases can lead to chronic breathing problems, permanent lung scarring, respiratory failure, severe bleeding from damaged blood vessels. Effects on the immune system. TB causes prolonged immune activation, which can lead to chronic inflammation. In HIV-positive individuals, TB accelerates disease progression. Effects on other organs. When TB spreads through the bloodstream, a condition called miliary tuberculosis, it can affect multiple organs simultaneously. This form is life-threatening and may cause organ failure. TB meningitis can cause permanent neurological damage or death if untreated. Diagnosis of tuberculosis. Diagnosing TB requires multiple approaches. Common diagnostic methods include chest X-ray, which shows lung damage or cavities, sputum smear microscopy, which detects TB bacteria under a microscope, gene expert test, a molecular test that detects TB DNA and drug resistance, tuberculin skin test, Mantoux test, interferon gamma release assays, IGRA, blood tests, CT scan or MRI for extrapulmonary cases. Sputum testing is the gold standard for confirming pulmonary TB. Treatment of tuberculosis. TB is curable, but treatment requires strict adherence. Standard treatment regimen. Active TB is treated with a combination of antibiotics for at least 6 months, isoniazid, rifampicin, pyrazinamide, ethambutol. The first 2 months are called the intensive phase, followed by a continuation phase. Stopping treatment early can lead to drug-resistant TB, which is much harder and more expensive to treat. Drug-resistant TB. There are 2 major types: MDR-TB, multidrug-resistant TB, resistant to isoniazid and rifampicin; XDR-TB, extensively drug-resistant TB, resistant to even more drugs. Treatment for resistant TB can last 18 to 24 months and involves stronger medications with more side effects. Prevention of tuberculosis. Preventing TB involves multiple strategies. Vaccination. The BCG vaccine provides partial protection, especially in children. It does not fully prevent pulmonary TB in adults, but reduces severe forms in children. Infection control measures. Prevention strategies include improving ventilation in homes and workplaces, wearing masks in high-risk settings, early detection and treatment of active TB cases, screening close contacts, treating latent TB infection. Lifestyle and health measures. Maintaining strong immunity is critical. This includes eating balanced nutrition, managing chronic diseases, avoiding smoking, reducing alcohol use, seeking early medical attention for persistent cough. Complications of tuberculosis. If untreated, TB can lead to permanent lung damage, respiratory failure, severe weight loss, brain damage, and TB meningitis, spinal deformities, death. TB remains fatal if not treated properly. Global impact of tuberculosis. TB remains one of the world's leading infectious killers. Millions develop TB each year, and over 1 million die annually. The burden is highest in parts of Asia and Africa. TB is closely linked to poverty, overcrowding, and limited healthcare access. Prognosis and recovery. With proper treatment, most people recover completely. Symptoms usually improve within weeks of starting medication, but the full course must be completed. Early diagnosis greatly improves outcomes. Conclusion. Tuberculosis is a serious but preventable and curable infectious disease caused by Mycobacterium tuberculosis. It spreads through the air and primarily affects the lungs but can damage multiple organs. The disease can remain dormant for years before becoming active. Symptoms include persistent cough, fever, night sweats, and weight loss. TB affects the lungs by destroying tissue and impairing breathing. If untreated, it can spread throughout the body and become life-threatening. However, with proper diagnosis, a full course of antibiotics, vaccination programs, and preventive measures, TB can be controlled and eliminated. Understanding TB is critical because awareness leads to early detection, and early detection saves lives. That's all for today. Stay safe, stay motivated, and I'll see you in the next video.